Okay, so I didn't post our, I still have it on my phone, but I'll post our session from last week, our class from last week. But this is seeking safety. Again, a good model for folks that have comorbid conditions, PTSD, and substance use. There are 26 sessions available outlined in this book. So you basically, if you see somebody once a week, you've got 6 months of material from this book by itself. This is designed to be in a group format, although you can take the information out and use it individually. You don't necessarily have to have a group, although it is designed to be in a group. Again, it's a trauma-informed perspective, and you want people. You want as counselors to stop asking what's wrong and start asking what happened. Again, what makes this difficult as counselors? Why is this a difficult prospect for us? Especially for substance using population, especially for an incarcerated substance using population. Something's wrong with them. They're in jail. They were wrong.
Yeah, because what happened makes them a victim, when sometimes in some cases you want to look at them other ways, other than that.
Does it make them a victim, or does it help you understand where they're coming from?
It helps get a backstory or a background of what they're dealing with, or why maybe their issues are, why they have those issues, or maybe help you understand how to look at the issues if you know where their perspective is coming from.
Yes. So you want to know what happened. Again, we've studied the ACE study, the adverse childhood experiences, and we've seen that stair step on how prevalent that trauma is, especially for folks that use substances. It's very clear now to us that a minority of people that are heavily substance dependent have no trauma. An extreme minority of people. Most people that are dependent upon substances have some significant trauma in their history. And until we address that, I would argue that we're not reaching the root cause of that addiction. But it's difficult. We want to focus on the here and now. And this is a very here and now type of technique, we'll find out. The patient stages in seeking safety. Number one, this is what makes it here and now. We want safety now, future. This is the foundation for all your therapeutic work. It's a little different than TFCBT. Trauma-focused cognitive behavioral therapy is working towards a narrative. You're working towards that person going through and talking about that unsafe situation in their past. Seeking safety does not seek any sort of narrative. It's only what it says, it's seeking safety now. It's seeking safety for the future. It's not necessarily going back. It will eventually possibly go there, but as far as this book is not looking for a narrative. This book is looking to give people coping skills to be safe in the here and now. And so that's what will be good for your clients, because a lot of clients come to session, I don't want to go to a counselor, I don't want to talk about all that crap that happened to me when a kid. I don't want to be a victim, I'm going to move past that. But here are the patient stages. Number one, you have to have safety. Even when you do TFCBT, your patient has to be safe for them to be able to go in and talk about bad stuff that's happened to them. Number two, I can't talk very much. Kira, do you mind talking? What's number two?
Morning. After achieving safety, the patient delves into the past in detail and faces extreme feelings of pain and mourning that result. transforms the story of shame and humiliation into one of dignity and virtue.
Okay, so by instead of saying what's wrong with you, and instead what happened, it's not something that's going to be shameful and humiliating. It's something that we can then turn into something that's somebody's going to be able to reframe their lives experience. We want to develop dignity and virtue. And then Laura, what's the third one there?
Reconnection. After working through mourning, the patient emotionally reconnects with life in the present, establishing stable relationships, a career, altruistic activities, and a capacity to develop meaningful life goals, creating a new identity.
Okay, so that may seem like a pretty far stretch for somebody that's down and out, addicted to substances, but that's actually what this technique has been shown to do. So you're looking at a strong evidence-based practice, something that does take somebody into transformative change. Okay, so now those were the patient stages. Keep those separate in your notes. Now we're going into the therapist stages. Jennifer, if you could help me.
Safety, therapist, empowers the patient to regain control, self-efficacy, helps the patient identify cues of who, what, and where are safe, teaches coping skills that may never have been learned in childhood, assesses the extent and impact of substance abuse and develops a plan for abstinence, closely monitors the patient's current substance use and craving, provides psychoeducation rehab services about the diagnoses of PTSD and substance use disorders.
Okay, so that's what we want right off the bat. We're going to do those things. And this is still phase one, safety. Lori, read the first line there.
The therapist is active and directive, but always tries to give the patient control rather than controlling the patient. The therapist seeks to understand the patient's self-destructive behaviors as symbolic or literal reenactments of the initial abuse.
Okay.
Y'all keep going?
I think that's an important one to break down. So, active and directive. So that sounds a little backwards from, well, not necessarily, I guess. Active and directive. So it sounds like we're going to direct the person, but we always try to give the patient control rather than controlling the patient. That sounds a lot like our trauma focus, our motivational interviewing, our TFCBT, seeking safety. We don't want to control the patient. We're going to give, you remember the Seabiscuit clip I showed you all? I mean, let the patient run. Let them go where they want to go. There's still a big a spirit of that in this. You're not trying to control that person. The therapist seeks to understand the patient's self-destructive behaviors as symbolic or literal reenactments of the initial abuse. So many times people, when they get caught up in these cycles of addiction, are either reenacting the abuse or trying to cover it up, or, it definitely is tied to those feelings. Sydney, could you continue, please?
The therapist does not offer dynamic interpretations, confront offenses, focus the patient on examining the relationship between patient and therapist, seek insight or personality change, or confront an abuser or family members who deny the trauma.
Okay, what's that fourth one there? Does that fourth one sit wrong with anyone who wants to be a therapist?
Yeah.
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 When I did this training, it was like nails on a chalkboard. How am I not supposed to seek insight? That's what I'm supposed to do.
Yeah.
So they actually train you, and when you do this, they train you not to delve into when you're giving the material. Tell me more about it. So what does that mean to you? Tell me more would be okay, but so what does that mean to you, or why do you think you feel that way? They want those gone in the first stage of this. And that's very tough. I'll try to show a video, but there's actually a little nuance to this where they don't want you to do a lot of therapy up front. It's more teaching and just the person allowing them to be in that session. So,
Is that building rapport?
pardon, Laura?
Is that for building rapport, so they don't feel like they're in a counseling session, that it's more relaxed?
It is. Do you guys have Seeking Safety up there at where you're at, or?
I think I have the book on my bookshelf.
Okay.
No, but I think they did it out at the treatment center in Winoka, and there's 2 girls that were in supervision with me that worked out there, so I kind of heard about it.
Yeah, absolutely. You want them. You're right on point. You want the folks that are listening to you to feel at home. You want them to feel safe. You want them. You're not going to be judged when you come here, and so. Yeah, and you're not going to be forced to do anything you don't want to do. So right up front, you're wanting that person just to feel like this is a safe place. That's good to bring out here because it goes against the grain of what we want to do. And right up front, we're not going to confront an abuser or family members who deny trauma. All right, then this is the second therapist stage. Dominique, help us out, please.
Morning. Therapist is a witness and ally. Help the patient face the devastation inflicted by trauma and substance abuse. Elicits a life history, insight, personality change, and exploration of underlying issues.
So after now you see that elicit a life history. It's after that initial, contact in group that we go and that's the person's feeling safe. And they actually, I would make an argument that at no place does Dr. Najovitz ever say that a person has to do this. A client, if they don't feel like they want to do this, go think about personality change and talk about all that stuff, they don't have to. There are a lot of worksheets in here that allow people to do that on their own time, but they don't necessarily have to share that in group. All right, and lastly, Brooke.
The reconnection therapist supports efforts to create a new life, helps process trial and error at new roles and activities, helps establish new goals, evaluation possible confrontation and abuser.
Okay, so again, it progresses in stages. If we're in the first part of the stage, which I would argue is really most of this, you're mainly just making sure that person's safe, getting safe coping skills. There's a lot of really good things in here, but towards the end, this is where you move forward. And this is it. This is what I want you to get from today's session. The session format. They say, when they give you this training, that if you have a bachelor's, at least in a psychologically related field, and you buy this book, and you follow this session format to deliver this book, you still will have efficacy with your clients. You still will have results with your clients. They've done a research model with that, with having no real formal training, even less than what we're doing, just taking the book, reading it, and delivering it with this session format. And it's been shown to have a reduction in PTSD symptoms and a reduction in substance use. So, I mean, that's a pretty strong statement for what Dr. Najovitz has produced here. But, go ahead.
I was just gonna say, I read, I was working on it today, and I read where it said that they don't even say to read the book, they say just dive in.
Just dive in. Okay. There's a lot of, they want you to just dive in and do it. Follow the format though. If you do the training, they really stress, follow the format. So here's the format. Lori, why don't you go ahead and since you're up next week, tell us a little bit about the check-in.
The check-in, about up to 5 minutes per patient. You ask 5 questions. How are you feeling? What new coping have you done? Has there been any substance use or other unsafe behavior? Did you complete your commitment? And community resources update.
So
And you have,
So typically, if you're doing this, you'll have that handout with the check-in for everybody to get used to it. So if you're delivering this group, you'll have those 5 questions on there, and so each one of your person will then go around. Each one of your group members will go around the table, and they'll say how they're feeling. I'm feeling sick. What good coping have you done? I went to the doctor yesterday and got diagnosed and got some antibiotics. Any substance use or other unsafe behavior. I'm taking medications and I've taken some Tylenol. Did you complete your commitment? My commitment was to be here this week and teach class, so yes, I did complete my commitment. Community resource. Okay, what is that? Community resource is you want your folks to know that there are resources out in the community to help them. So if somebody's homeless, if somebody's jobless, if somebody doesn't have enough education, if somebody is having their hot water or their gas turned off, there are resources out there for folks. So you want them to then in group, because these are the kind of problems, day-to-day problems that people go by. If you don't have heat right now, you're in an unsafe situation. So we need to figure out a community resource for you to, well, can you go to the shelter? Can you go to Catholic Charities? What can you do to help yourself? So we want to halfway in this, when we do the check-in and when we do the check-out, they'll follow kind of the same thing. What community resource are you going to access? I'm going to go to Catholic Charities because I know sometimes they help with deposits on utility bills. Okay, then we've got number 2 here, Brooke.
an application.
Each one of these sections has a quotation. Hey. So there's a quote from the book. Kira, what's the quote?
It's never too late to be what you might have been.
Okay, so what does that mean?
It's never too late to turn around, not to give up because you can still move forward no matter how far you are, how deep you are.
Perfect. I like
I used
that.
that in group last week.
Do what?
I used that quote in group last week.
Wow, fantastic. So that's all really you have to do for the quotation is just get somebody that knows what it is and sum it up. So very good job summating what that is. You don't want to rehash it. You don't want to spend too much time on it. But now what will flow out of the quotation, your group will have a topic that's centered around that quotation. So don't let the past make too much of what you're going to be in the future. So then it's talking about seeking safety treatment. So you'll actually copy these. These are handouts. You'll actually copy these and hand them out to your participants. So you kind of go over, what if I miss a session? So it has things lined out for you. You don't have to be an expert in delivering a group. You can get this book and it'll teach you how to do the group. Practical information about your treatment. call, in situations in which to call for help if you feel in danger of using a substance. There's a treatment agreement in here. So you can see right off that you're going to have some resources with this. It's about $47, but you'll get some use out of it. Okay, so then what's number 3? Sydney.
Discussion and practice. Relate the topic to the patient's lives in depth most of the session.
Okay. So then we'll go into like this one here. So what would be the main point of that?
Overcoming suffering.
Yeah, overcoming your suffering. Okay, so then
I
this
just
is,
did a presentation about deaf people in my last class, and I talked about Helen Keller.
did you really?
Yeah.
Well, I've just got all kinds of connections tonight with Laura and Sydney. How about that? I'm glad I didn't miss. So here's what it's got. What we just talked about in our PowerPoint: stages of healing, safety, warning, reconnection. So you're going to teach this stuff. Remember, there's a focus on rehab, on teaching with this technique. These are great. What these things here? There are 82 roughly safe coping skills that you will copy and give to your participants. If this wasn't copyrighted, I would copy them off and give them to you because they're good coping skills. So pick one. I want each one of us to pick one of those and tell me how you're going to apply it the next week before we come back to class. All right, so we'll start with Jennifer. You want to go?
Set boundaries.
Okay. How are you going to apply that?
Like if I was the person that was like, what do you mean?
Yeah. How? No, I'm actually going real deal with our lives.
Oh.
No role play. Everybody can use these.
I'm going to set boundaries with my daughter and not let her manipulate me.
Okay, fair enough. You have a tween-age daughter?
8.
Oh my, getting up there. Okay, set boundaries, set limits. Okay, I like that. Let's see here, Dominique. What do you got to choose?
I'm gonna do the best I can with what I have. I'm gonna make it where it's okay that I can't buy everything that I want. These babies, brand new. And if I can find used good stuff, that it will be okay, and I'm not letting anybody down.
All right, right on. Very good. Good plan. Brooke, what do you think?
Well, my first thought was cry. Let yourself cry.
That's okay.
Because I'm at a year right now where I went through a really bad time with my husband. He got really sick and almost died. So a year ago, we were in St. Francis Hospital thinking that he was going to die. So I'll do that.
Okay. All right. It's okay to cry. Absolutely. That's a safe coping skill. Lori,
I'm
what?
really good at it too. So.
Lori.
What stood out to me was persistent. I've been trying to find a job in the field and can't, so I got just a job. And I've got PowerPoint and 2 papers and 5 questions, and then that's the end of their semester, but I'm gonna keep pushing on
Okay.
and be persistent.
All right. That's a good, safe coping skill. Are you looking to move to Enid if you need a job?
No, I wasn't planning on it. I have thought about driving though.
Right. Might have a space open, so anyway. Kiera, which one looks good for you?
I was thinking, create meaning.
Okay.
So, yeah, just anything that happens, even bad things, try to, create some meaning to why I might be going through it or having to deal with anything. Turn it into something good.
I like that. I like that a lot. That's safe coping. Laura, what do you think?
The first thing I noticed was that one too, the create meaning. But I also like ask for help, not trying to do everything yourself. I like to do everything myself because I want to do it my way, the way it needs to be done. And I sometimes almost kill myself because I want to do everything for everybody.
That's an important one. Especially for those of us that are in helping professions. We sometimes don't ask for help ourselves. So, absolutely. Let's see here. I don't like when in doubt, do what's hardest. My gosh. Let's see here.
Sydney didn't check one.
Oh, okay. Oh, Sydney, you didn't do one? Oh, Sydney, I'm sorry. I'm coming
I
back.
could leave her out.
Sydney, which one? I didn't do that on purpose.
Well, the first one I noticed was when in doubt, do what's hardest, but I think I'm gonna go with inspire yourself.
Okay.
I've had a really rough year, and I don't know, I've been so focused on just like getting through it that I've let a lot of things slide that I used to really love doing. So I think if I inspire myself, then I will enjoy things more.
Thank you. That's a good one too. Definitely safe coping skill. Let's see here. I'm going to try take good care of your body, and part of that is going to be getting out of here in not too much longer. So, anyway, good job. This is kind of what the sessions are. There'll be a topic that you'll be able to pull from, and they're pretty easy to deliver. And so then you'll kind of that's the discussion practice. I wanted to kind of jump in so you see this is one of the better ones. You can actually use these safe coping skills at any time. They've got some little cards, and you can actually like randomly pass them out to group members. How are you going to do that safe coping skill? Because they go on. There's 82 of these. So lots of things to copy.
We have something really similar to that we give out to the guys as part of their books when they first start group. It's like a spreadsheet kind of, but it's got all kinds of safe positive coping skills, and it's like a 3-page list.
I commend that. I definitely, you want folks to learn new ways of coping besides shooting up or smoking or drinking or whatever it is. That's what we're into, is replacing those with something healthy. Ideas for commitment. So again, when before you leave, basically what I was doing with y'all was getting y'all to commit to one of those before you stepped out. So everybody remember your coping skill. You're committed to that before next week. So check out briefly, and then you'll go over what community resource what are you gonna get used today or use the next week before we come back. All right. Let's see here. What else would be useful? I'll show you just about 5 minutes of DVD of what it looks like.
I've got my role play set up as an individual, that's gonna be all right, right?
Yes, absolutely. Yeah, this doesn't have to be in a group. See if their DVD player doesn't work, then we'll just call it good. Go home. Ah.
You don't just hit the middle blue button.
I'm trying. It just doesn't. I don't understand why it works for some and not for others.
It knows you don't feel good, you're ready to go home.
Well, it's frustrating. I'll try one more. I've got more DVDs here.
Now there it is.
Lori, I kind of want you to see that so you got a feel for it. I'll tell you what, I'll rip a little bit of it and put it on YouTube just for the class. Then I'll take it down. So I'm sure it's copyrighted.
What, on that same thing that I was reading today, it said that, you can reprint and recopy things so long as it's not for like a clinic.
Yeah, you can use it for, you can copy anything in that book as long as it's for a client.
Yeah.
So technically y'all aren't clients.
Right.
Crap. I'm so frustrated with that. Okay. What else did I post online? That's not going to show up. Ugh. That's just ridiculous. Don't even put a player there or a DVD drive in there if it's not going to work. Here's a session asking for help. So I actually posted a session for you guys, for y'all. So that kind of gives an idea. Also posted something on session format. Check out, look for commitment. One thing you got out of today's session, any problems, new commitment. So this is it. And this should help you. Any other questions? Again, I'll try to rip a little bit of it and put it on YouTube for a minute. Thanks for putting up with my voice. Everybody have a good week, and I'll see you next week. We'll be reviewing for an exam. Be working on your papers. They're due. Your papers are due.